We think of medical professionals as exactly that, professionals. But even the best can cause a tragic accident. That is the case of Gena, a woman who lost a leg due to a medical mix-up. Gena is a sweet 67-year-old grandmother who is going into Doncaster Royal Infirmary in England for a simple medical procedure. That is, until a catheter wire was accidentally knocked to the floor and caused a mix-up with a cleaning disinfectant. One of the staff members accidentally injected her with the disinfectant. At first, all seemed fine, until Gena was screaming in agonizing pain. Her skin soon began to bubble, turning white, and eventually completely peeling off. She nearly lost her life that day and had to stay in the hospital for another 2 months. The heartbreaking part of the story is Gena describing what it was like to wake up from the hospital with no leg. I woke up and I went, "What's wrong here?" I tried to sit up and I couldn't. Then it hit me. I'd lost my leg, Gena said. I had to come to terms with it. Everything was a challenge. They had to hoist me out of bed to put me into a chair. I'm 67. I've got 20 years left. I've got to try and make a life. This must not happen again. Gena has now made it her life's mission to help make sure accidents like this don't happen again. She has premiered on a number of different platforms spreading awareness of the importance of medical safety and how often this truly does happen. In England alone, there are 12,000 avoidable hospital deaths that happen each year. Regina Turner was going in for what already seemed like a grim surgery: left-sided craniotomy bypass. Cerebral bypass surgery is performed to restore or revascularize blood flow to the brain. A cerebral bypass is the brain's equivalent of a coronary bypass in the heart. The surgery connects a blood vessel from outside the brain to a blood vessel inside the brain to reroute blood flow around a damaged or blocked artery. The goal of bypass surgery is to restore blood supply to the brain and prevent strokes. Before undergoing surgery, Regina was still in pretty good health, besides the many strokes she was suffering with. After her surgery, she needed constant care for basic needs. She continued to suffer from anxiety, distress, deep depression, and facial disfigurement. The medical team would soon find the cause of the problem. They had performed the wrong surgery. Instead of originally performing a left-sided craniotomy bypass, they performed a right-sided craniotomy bypass. After realizing their mistake, surgeons put Turner back under, this time operating on the left side. Sadly, she was still in poor condition even after the correct surgery. Typically, before a major surgery like hers, the doctors go through every part of the surgery beforehand to ensure all goes well. But in order for this mess-up to happen, many steps were overlooked. Regina Turner soon began her lawsuit against the hospital for the horrible way they handled her surgery, causing her permanent disabilities. On January 19, 2006, Sherman Sizemore was attending Raleigh General Hospital for an exploratory surgery. For several months, the man was suffering with a mysterious abdominal pain. After discussing it with his doctor, they decided it would be best if he went under an exploratory surgery in hopes to find what was causing the unusual pain. Sadly, this would be the biggest mistake Sherman would ever make. During the surgery, Sherman experienced what is commonly known as anesthetic awareness, which is a rare condition that occurs when surgical patients can recall their surroundings or an event, sometimes even pressure or pain. related to their surgery while they are under general anesthesia. Basically, Mr. Sizemore could feel, hear, and sense every part of his surgery, but was unable to move or communicate to the surgeons. According to his anesthesiologists, the drug succeeded in numbing the patient, but failed miserably overall, being unable to render him unconscious. This event was all too traumatic for the man to deal with, and he slowly began to lose his mind. His family recounts his story, saying that weeks after the surgery, Sherman began to feel as though people were trying to bury him alive. The family has been reluctant to go into too much detail about the final days leading up to Sherman's ultimate demise. On February 2nd, 2006, Sherman Sizemore committed suicide by a self-inflicted gunshot wound to the head. He was said to have committed the act after the surgery, not being able to deal with the trauma. He was a 74-year-old minister from West Virginia. There were no previous signs of psychological problems before the tragic event that was his surgery. The loved ones of Sherman sued the hospital and won an undisclosed amount. Another person who experienced anesthetic awareness during a 5-hour eye surgery gave the following statement to NBC. "The reason people sue is because they want to be acknowledged. They don't want to be told, 'You weren't awake. It was a dream.'" Now, before you go and think that this could never happen to me, remember, nearly 40,000 people a year experience this in the United States alone. Jessica Santillan was a 17-year-old born with a life-threatening heart and lung disorder. Jessica first came to the United States from Mexico with her family, in hopes to find Jessica treatment and save her life. The town they moved to even raised money for the girl's surgery. It made her feel as though there was a glimmer of hope in what seemed like a death sentence. Unfortunately, Jessica would never live through the surgery. It took some time, but soon Jessica went under for her double lung transplant in the care of Dr. Jaggers. Her body immediately rejected the organs. For those of you that don't know, transplant rejection is a process in which a transplant recipient's immune system attacks the transplanted organ or tissue. This is because the person's immune system detects that the antigens on the cells of the organ are different or not matched. The truth behind what was happening was a terrible medical mix-up. See, Jessica had type O blood, meaning she couldn't get a transplant of type A. Her body would reject it and fight off the organ before killing her. So, how did Jessica, a girl with type O, end up with type A lungs? All the blame is on Dr. Jaggers. After receiving a phone call about a possible match for Jessica's surgery, Dr. Jaggers took the organs without even asking what blood type they were, which is common practice to always ask. "I'm ultimately responsible for this because I'm Jessica's doctor and I'm arranging all this," he says. But honestly, I look back and yeah, if I had made one more phone call or if I had told somebody else to make a phone call or done something different, maybe it would have turned out differently. But you know, those are all 2020 hindsight. The team of doctors soon found out and for days did nothing. There was nothing they could even do, but still they didn't tell her or her family. They just watched as the poor girl laid in bed, slowly dying in tremendous pain. We had already put in the new organs, and we had actually come off the heart-lung machine off bypass, and we were planning to get ready to close the chest and move up to the ICU. And it was about that point, about an hour 15 minutes, after we had put the organs in, that we got the call that this was an incompatible transplant. And we, of course, knew what that meant at that point, says Dr. Jaggers. After a week, Jessica was brain dead. Her parents had to make the decision to keep her alive on machines or take her off of life support. On the 11th day, Jessica died. At this point, her parents had been informed of the medical mishap that killed their daughter. They let my baby lay on that bed in there for another 11 days before they managed to do something about it, before they decided to fess up to what they'd done, says Jessica's mother. The hospital now makes sure to practice the utmost care when it comes to transplant surgery. In 1996, Earl Scarra was in a tragic car accident that left him severely brain damaged. He lapsed into a coma and never recovered from it. His wife, Lydia Scarra, never gave up on her beloved husband and tried with the doctors to fight for his recovery. But alas, it was all to no avail. Earl would never recover, and Lydia didn't have the heart to take him off of life support. It all seemed hopeless for nearly 16 months, until Earl started showing more promising signs. Slowly but surely, Earl was coming back piece by piece. First with speaking, relearning math, and other studies at first grade level. For years and years, Lydia worked with him until she put him in a 24-hour care facility where she would still visit him for hours. On May 7th, 2006, Lydia received one of the worst calls of her life. The caller from the Liberty Manor residency told her that Earl had been vomiting all day. Lydia, being the caring partner she was, rushed to his aid. She brought him home, and within hours, he began vomiting a black, tar-like substance. He died in her arms. The autopsy showed a number of odd things inside Earl's stomach, such as ketchup packages, plastic bags, candy wrappers, and paper towels. The medical examiner said that the contents of his stomach is what led to his death. Here is exactly what he said. Hypertensive heart disease due to mechanical obstruction of the GI, gastrointestinal tract, from the foreign objects. Lydia sued Liberty Manor for abuse, neglect, and wrongful death. An Arizona jury awarded $11 million to Lydia Scarra. This is what she had to say. I want this to be a lasting victory for all individuals with TBI or other disabilities living in the assisted living centres or group homes. Earl Scarra was only 36 years old.